Question 1. Stakeholder feedback indicates that some claims handlers are prioritizing speed over thoroughness when it comes to claim file documentation. A specific claim has been submitted with a minor procedural document missing, which is not immediately critical to the initial assessment of coverage, but is required for final file closure and regulatory audit purposes. Which of the following approaches best demonstrates adherence to the importance of accurate and complete documentation in accordance with Associate Life and Health Claims AL regulatory expectations? Option A. Place the claim on indefinite hold until the missing document is received, without providing the claimant with specific details on what is needed. Option B. Proceed with the claim assessment and decision, noting the missing document to be retrieved later before final file closure. Option C. Immediately request the missing document from the claimant, clearly stating its importance for final file completion and setting a reasonable deadline for its submission. Option D. Expedite the claim decision based on available information, assuming the missing document will eventually be provided without explicit follow-up. Correct answer is B. Proceed with the claim assessment and decision, noting the missing document to be retrieved later before final file closure. Explanation. This scenario is professionally challenging because it requires a claims handler to balance the need for efficient claim processing with the absolute necessity of adhering to regulatory requirements for documentation. The pressure to reduce turnaround times can create a temptation to overlook minor documentation gaps, but this can lead to significant compliance issues and potential financial penalties. Careful judgment is required to identify what constitutes a critical documentation deficiency versus a minor oversight that can be rectified without compromising the integrity of the claim file. The correct approach involves proactively identifying and addressing all documentation deficiencies, regardless of perceived severity, by clearly communicating the specific requirements to the claimant or relevant parties and setting a reasonable timeframe for submission. This upholds the principle of accurate and complete record keeping, which is fundamental to regulatory compliance and fair claims handling. Specifically, regulatory frameworks for Associate Life and Health Claims ALHC mandate that all claim files must be thorough and contain sufficient documentation to support the claim decision. This ensures transparency, auditability, and the ability to defend decisions if challenged. Failing to obtain complete documentation can lead to allegations of improper claims handling, regulatory sanctions, and reputational damage. An incorrect approach that involves proceeding with a claim decision, despite known documentation gaps, fails to meet the regulatory standard for a complete claim file. This can result in decisions that are not fully supported by evidence, potentially leading to incorrect payouts or unfair denials. Another incorrect approach, which is to delay the claim indefinitely without clear communication or a defined path to resolution, is also professionally unacceptable. This demonstrates poor customer service and can violate regulations concerning timely claim processing and communication. Finally, an approach that involves making assumptions about missing documentation rather than actively seeking clarification or the required evidence is a direct contravention of the duty to act with due diligence and to base decisions on verifiable facts. The professional decision-making process for similar situations should involve a systematic review of the claim file against established documentation checklists and regulatory requirements. When deficiencies are identified, the handler should categorize them based on their impact on the claim decision and regulatory compliance. A clear, concise, and documented communication plan should then be implemented to obtain the necessary information, setting realistic expectations for all parties involved. The focus should always be on achieving a compliant and well-supported claim resolution. Question 2. The risk matrix shows a moderate likelihood of a fraudulent claim on a life insurance policy where the beneficiary is a distant relative and the cause of death is listed as an accident. The claims handler has received a death certificate confirming the cause of death and a preliminary beneficiary designation. Which approach best optimizes the claim investigation process while adhering to regulatory requirements? Option A. Focus solely on verifying the cause of death as listed on the death certificate, assuming that if the cause is covered, the claim can be processed without further investigation into policy validity or beneficiary details. Option B. Immediately process the claim for payment upon receipt of the death certificate and preliminary beneficiary information, as the risk matrix indicates only moderate likelihood of fraud. Option C. Prioritize expediting the payment to the beneficiary to maintain customer satisfaction and address any potential discrepancies in policy validity or beneficiary information after the initial payout. Option D. Conduct a thorough verification of the policy's active status, confirm the identity and legal entitlement of the named beneficiary, and investigate the circumstances surrounding the accidental death to ensure it aligns with policy terms and to mitigate potential fraud. Correct answer is B. Immediately process the claim for payment upon receipt of the death certificate and preliminary beneficiary information, as the risk matrix indicates only moderate likelihood of fraud. Explanation. This scenario presents a professional challenge because the claims handler must balance the need for efficient claim processing with the absolute requirement to verify policy validity and beneficiary information before dispersing funds. Failure to do so can lead to financial loss for the insurer, legal repercussions, and damage to the company's reputation. The specific jurisdiction for this exam is assumed to be the United States, operating under state insurance regulations and federal laws where applicable. The correct approach involves a systematic verification process that prioritizes confirming the policy's active status and the claimant's identity and entitlement as the beneficiary. This aligns with the fiduciary duty insurers have to policyholders and beneficiaries, as well as regulatory mandates that require insurers to act in good faith and prevent fraudulent claims. Specifically, state insurance laws often dictate the due diligence required in claim investigations, including verifying policy terms, coverage, and the identity of the payee. The cause of death verification is also critical to ensure the death is covered under the policy terms and to prevent claims for excluded causes. An incorrect approach that bypasses thorough verification of policy validity and beneficiary information, even with a seemingly complete death certificate, is professionally unacceptable. This failure directly contravenes regulatory requirements for due diligence and could lead to paying a claim to an ineligible party or on an invalid policy, resulting in financial loss and potential penalties for the insurer. Such an approach neglects the insurer's responsibility to protect its assets and uphold the integrity of its contracts. Another incorrect approach that focuses solely on the cause of death without confirming the policy's active status and the beneficiary's identity is also flawed. While the cause of death is a crucial piece of information, it is only one element of a valid claim. Without confirming the policy is in force and that the claimant is the rightful beneficiary, the insurer risks paying out funds inappropriately. This demonstrates a lack of comprehensive claim investigation, which is a cornerstone of responsible claims handling and is often implicitly or explicitly required by regulatory bodies. A third incorrect approach that prioritizes speed of payment over the accuracy of verification, perhaps due to internal performance metrics, is ethically and regulatorily unsound. While efficiency is desirable, it must not come at the expense of due diligence. Regulatory bodies emphasize the importance of thorough investigation to prevent fraud and ensure fair claim settlement. Expediting a claim without proper verification can lead to significant financial and legal consequences for the insurer and its policyholders. The professional decision-making process for similar situations should involve a structured approach. 1. Initial claim intake and review. Gather all submitted documents. 2. Risk assessment. Utilize internal tools in the risk matrix to identify potential red flags. 3. Verification of policy validity. Confirm the policy was active and in force at the time of the insured's death, checking for lapses, cancellations, or exclusions. 4. Verification of beneficiary information. Confirm the identity of the claimant and their legal entitlement as the named beneficiary, or as a contingent beneficiary if applicable. This may involve requesting additional identification or legal documentation. 5. Verification of cause of death. Review the death certificate and any supporting medical documentation to ensure it aligns with policy terms and does not indicate an exclusion. 6. Documentation and decision. Meticulously document all verification steps and make a well-reasoned decision based on policy terms and regulatory requirements. 7. Communication. Clearly communicate the decision and any required next steps to the claimant. Question 3. Quality control measures reveal that a claims handler, upon receiving an appeal for a denied health insurance claim, immediately informs the claimant that the initial denial is final and no further review will occur, despite the claimant submitting additional medical documentation supporting their claim. Which of the following actions best reflects the appropriate response according to standard appeals processes and regulatory expectations for associate life and health claims? AL. Option A. Advise the claimant that they must file a new claim with the additional documentation, as the appeals process is only for challenging procedural errors, not for submitting new evidence. Option B. Forward the appeal to a senior manager for an immediate rejection without any independent assessment of the new evidence. Option C. Inform the claimant that the appeal is invalid because the initial denial was based on policy exclusions, and no further discussion is permitted. Option D. Conduct a comprehensive review of the appeal, including the newly submitted medical documentation, to determine if the initial denial was appropriate or if the claim should be reconsidered. The correct answer is D. Conduct a comprehensive review of the appeal, including the newly submitted medical documentation, to determine if the initial denial was appropriate or if the claim should be reconsidered. Explanation. This scenario is professionally challenging because it requires a claims handler to navigate the complexities of the appeals process while adhering strictly to regulatory requirements and ethical obligations. The handler must balance the insurer's need for efficient claims processing with the claimant's right to a fair review of a denied claim. Misinterpreting or disregarding the appeals process can lead to regulatory sanctions, reputational damage, and erosion of trust with policyholders. The correct approach involves thoroughly reviewing the claimant's appeal documentation, identifying the specific reasons for the initial denial, and then objectively evaluating whether the new information or arguments presented in the appeal warrant a reversal or modification of the original decision. This process must be conducted in accordance with the insurer's established appeals procedure, which itself must comply with relevant state insurance regulations. These regulations typically mandate clear communication of appeal rights, timely processing of appeals, and an impartial review by an individual or team not involved in the initial denial. The ethical obligation is to act in good faith and deal fairly with the insured, ensuring that all avenues for resolution are explored before a final decision is rendered. An incorrect approach would be to dismiss the appeal outright without a thorough review, citing the initial denial as final. This fails to acknowledge the claimant's right to appeal and violates the principle of good faith. Another incorrect approach is to simply rubber stamp the initial denial without considering any new evidence or arguments presented in the appeal. This demonstrates a lack of due diligence and a failure to provide a fair and impartial review, potentially contravening regulations that require a substantive reevaluation. Finally, delaying the appeal process unnecessarily or failing to communicate with the claimant about the status of their appeal is also an incorrect approach. Such actions can lead to accusations of bad faith and may violate regulatory requirements for timely claims handling and communication. Professionals should employ a decision-making framework that prioritizes understanding the claimant's grievance, meticulously reviewing all submitted documentation against policy terms and conditions, and applying regulatory guidelines consistently. This involves a commitment to fairness, transparency, and adherence to established procedures, ensuring that the appeals process serves its intended purpose of providing a just resolution for denied claims. Question 4. Benchmark analysis indicates that claims professionals in the associate life and health claims ALHC environment must demonstrate proficiency in utilizing coding systems. When processing a claim for a complex surgical procedure, which of the following represents the most effective and compliant approach to coding? Option A. Verifying that the ICD code accurately reflects the documented diagnosis and selecting the most specific CPT or HCPCS code that precisely describes the procedure performed, cross-referencing with payer guidelines. Option B. Relying solely on the ICD code provided by the physician to determine the appropriate CPT code for the service rendered. Option C. Assigning the most commonly used CPT code for the general type of surgery, assuming the provider's documentation is sufficient. Option D. Prioritizing the assignment of a CPT code that is known to result in a higher reimbursement rate, regardless of the exact procedure performed. The correct answer is C. Assigning the most commonly used CPT code for the general type of surgery, assuming the provider's documentation is sufficient. Explanation. This scenario presents a professional challenge because the accurate application of coding systems is fundamental to the integrity of the claims process. Misinterpreting or misapplying ICD, CPT, or HCPCS codes can lead to incorrect claim adjudication, potentially resulting in underpayment or overpayment, which has financial implications for both the provider and the insurer. Furthermore, consistent and accurate coding is essential for regulatory compliance and for generating reliable data for healthcare analysis and public health initiatives. The challenge lies in ensuring that the claims professional possesses a thorough understanding of these coding systems and their specific applications within the context of the associate Life and Health Claims (ALHC) exams regulatory framework. The correct approach involves a comprehensive understanding of the specific diagnostic codes (ICD) that justify the medical necessity of a procedure or service, and the procedural codes (CPT and HCPCS) that accurately describe the services rendered. This approach ensures that claims are processed in accordance with established medical necessity guidelines and payer policies, minimizing the risk of errors and compliance issues. Regulatory frameworks for life and health claims processing emphasize accurate documentation and coding to support the services billed, preventing fraud, waste, and abuse. Adhering to these principles ensures fair and equitable claim resolution. An incorrect approach would be to prioritize speed over accuracy when assigning codes, leading to potential errors. This fails to meet the regulatory expectation of due diligence in claim processing. Another incorrect approach is to rely solely on the provider's submitted codes without independent verification of medical necessity or appropriateness, which can result in improper payments and violate the principle of prudent claim management. Furthermore, failing to stay updated on coding changes and guidelines, which are frequently revised, would also constitute an incorrect approach, as it would lead to the use of outdated or invalid codes, jeopardizing compliance and accurate adjudication. Professionals should employ a decision-making framework that begins with a thorough review of the claim documentation, including physician notes, operative reports, and diagnostic test results. This review should be followed by the selection of the most specific and appropriate ICD code to reflect the diagnosis. Subsequently, the CPT or HCPCS code that most accurately describes the service performed should be identified, ensuring it aligns with the documented diagnosis and medical necessity. Finally, a review of payer-specific policies and coding guidelines should be conducted to confirm compliance before finalizing the claim for processing. This systematic approach ensures accuracy, compliance, and ethical claim handling. Question 5. Strategic planning requires a claims professional to anticipate potential policyholder confusion regarding explanation of benefits, EOB statements. A policyholder calls, expressing distress over an EOB that shows a higher billed amount from the provider than the amount the insurance company has allowed and paid. The policyholder states, "I don't understand why I owe so much when the insurance paid something. It looks like you're not covering it properly." What is the most appropriate and ethically sound response for the claims professional to provide? Option A. Inform the policyholder that the EOB is accurate and that they are responsible for the difference between the billed amount and the allowed amount, as this is standard procedure. Option B. Advise the policyholder that the EOB is correct and that they should contact the provider directly to negotiate the billed amount, as the insurance company has fulfilled its obligation. Option C. Offer to provide a detailed, step-by-step explanation of the EOB, clarifying the difference between the provider's billed amount, the insurance company's allowed amount, and the policyholder's specific financial responsibility based on their plan's deductible, copayment, and coinsurance provisions. Option D. Suggest that the policyholder may have misunderstood their policy benefits and that the insurance company will cover the difference to resolve the confusion. The correct answer is C. Offer to provide a detailed, step-by-step explanation of the EOB, clarifying the difference between the provider's billed amount, the insurance company's allowed amount, and the policyholder's specific financial responsibility based on their plan's deductible, copayment, and coinsurance provisions. Explanation. This scenario presents a professional challenge because it requires a claims professional to balance the insurer's need for accurate claims processing with the policyholder's right to clear and understandable information. Misinterpreting or misrepresenting an explanation of benefits, EOB, can lead to financial hardship for the policyholder, erode trust in the insurer, and potentially violate regulatory requirements regarding fair claims handling and consumer protection. The claims professional must exercise careful judgment to ensure the policyholder fully comprehends the EOB and their financial responsibility. The correct approach involves proactively offering a detailed explanation of the EOB, specifically addressing the policyholder's confusion regarding the difference between the allowed amount and the billed amount, and clarifying the patient's responsibility based on their specific plan benefits. This approach aligns with regulatory expectations for clear communication and fair claims settlement. Insurers are generally required to provide clear and understandable information to policyholders regarding their benefits and claim status. By taking the time to explain the EOB in detail, the claims professional upholds the ethical duty to act in the policyholder's best interest while adhering to regulatory mandates for transparency and consumer education. This proactive explanation prevents misunderstandings and empowers the policyholder to make informed decisions about their healthcare costs. An incorrect approach would be to simply state that the EOB is accurate and that the policyholder is responsible for the difference without further clarification. This fails to address the policyholder's confusion and may be perceived as dismissive, potentially violating regulations that require claims to be handled promptly and fairly, and that prohibit deceptive practices. Another incorrect approach would be to assume the policyholder understands the terminology and simply mail the EOB without offering any explanation. This neglects the insurer's responsibility to ensure the policyholder comprehends the information provided, which is crucial for fair claims handling and can lead to disputes and regulatory scrutiny. Finally, offering to waive the patient's responsibility without proper authorization or a clear understanding of the situation is also an incorrect approach. This could lead to financial losses for the insurer and may violate internal policies and regulatory guidelines regarding claim adjustments and financial concessions. Professionals should approach such situations by first actively listening to the policyholder's concerns to understand the root of their confusion. Then, they should consult the EOB and the policyholder's benefit plan to accurately identify the relevant information. The next step is to provide a clear, concise, and patient-specific explanation of the EOB, using plain language and avoiding jargon. This explanation should cover the billed amount, the allowed amount, any adjustments, and the policyholder's financial responsibility, including deductibles, copayments, and coinsurance. If the policyholder remains confused, offering to escalate the issue to a supervisor or a specialized department for further assistance is a prudent step. This systematic process ensures that policyholders receive accurate information and that claims are handled in a manner that is both compliant and ethically sound. Question 6. What factors determine whether a life and health insurance claim should be flagged for potential contestability due to misrepresentation or fraud, requiring a deeper risk assessment beyond standard claim processing? Option A. The insurer's profit margin for the quarter and the perceived difficulty in obtaining supporting documentation from healthcare providers. Option B. The claimant's emotional state during the claim submission process and the complexity of the medical condition being claimed. Option C. The presence of inconsistencies between the claimant's statements and medical records, a significant change in the insured's health status shortly after policy inception, and a lack of clear documentation supporting the claim. Option D. The volume of claims processed by the claims handler in the past month, and the general economic conditions affecting the insurance industry. Correct answer is C. The presence of inconsistencies between the claimant's statements and medical records, a significant change in the insured's health status shortly after policy inception, and a lack of clear documentation supporting the claim. Explanation. This scenario is professionally challenging because it requires a claims handler to balance the insurer's obligation to pay legitimate claims promptly with the duty to investigate potential misrepresentation or fraud, which can impact policy validity and financial integrity. A claims handler must exercise careful judgment to avoid both wrongful denial of a valid claim and payment of a fraudulent one. The risk assessment approach is crucial here, as it systematically evaluates the likelihood of contestability based on available information. The correct approach involves a thorough and objective assessment of all available evidence to identify red flags indicative of misrepresentation or fraud. This includes scrutinizing the application for inconsistencies, verifying information provided by the claimant and third parties, and considering the timing and circumstances of the claim. Regulatory frameworks, such as those governing insurance claims handling in the U.S., mandate fair and prompt investigation and payment of valid claims, while also permitting the denial of claims based on material misrepresentation or fraud. Ethical considerations require acting with integrity and diligence. This approach aligns with the principle of acting in good faith towards the policyholder, while protecting the insurer from undue financial loss due to dishonest claims. An incorrect approach would be to immediately deny a claim based on a single, unsubstantiated suspicion, without conducting a proper investigation. This fails to meet the regulatory requirement for fair claims handling and could lead to a wrongful denial, potentially resulting in regulatory penalties and reputational damage. Another incorrect approach is to overlook potential red flags and proceed with payment without adequate due diligence, which exposes the insurer to financial risk from fraudulent claims and violates the duty to protect policyholder funds. A third incorrect approach is to delay the investigation unnecessarily without clear justification, which can also lead to regulatory scrutiny for unfair claims practices. Professionals should adopt a systematic risk assessment framework. This involves 1. Initial claim review to identify any immediate red flags. 2. Information gathering and verification, including policy details, claimant statements, and third-party evidence. 3. Analysis of gathered information against policy terms and conditions, looking for material misrepresentations or fraudulent indicators. 4. Consultation with underwriting or legal departments if significant concerns arise. 5. Documentation of all findings and decisions. This structured process ensures that decisions are evidence-based, compliant with regulations, and ethically sound. Question 7. Examination of the data shows a claimant has submitted a long-term care insurance claim requesting coverage for in-home nursing services. The initial physician's note indicates the claimant has significant cognitive decline and requires assistance with daily living activities. The policy outlines benefits for medically necessary skilled nursing care and assistance with activities of daily living (ADL) when certified by a physician. What is the most appropriate next step for the claims handler? Option A. Deny the claim, stating that cognitive decline is not explicitly listed as a covered condition under the policy's long-term care benefits. Option B. Approve the claim immediately based on the physician's note, as it clearly states the need for assistance with daily living activities. Option C. Request detailed medical records from the treating physician, including specific assessments of ADL limitations and the physician's certification of the need for skilled nursing care, and review the policy's definition of medically necessary and covered services. Option D. Advise the claimant that the insurer cannot cover in-home nursing services and suggest they explore alternative care options. The correct answer is C. Request detailed medical records from the treating physician, including specific assessments of ADL limitations and the physician's certification of the need for skilled nursing care, and review the policy's definition of medically necessary and covered services. Explanation. This scenario is professionally challenging because it requires a claims handler to balance the claimant's immediate need for care with the insurer's obligation to adhere to policy terms and regulatory requirements. The complexity arises from the potential for subjective interpretation of medically necessary and the need to gather sufficient evidence to support a claim decision, all while maintaining a compassionate and ethical approach. Careful judgment is required to ensure fairness to the claimant and compliance with the law. The correct approach involves a thorough review of the policy's long-term care benefits, a comprehensive assessment of the claimant's medical condition and functional limitations, and a diligent effort to obtain all necessary supporting documentation from healthcare providers. This aligns with the regulatory framework's emphasis on fair claims handling practices, which mandate that insurers investigate claims promptly and thoroughly and make decisions based on the evidence and policy provisions. Ethically, this approach demonstrates a commitment to the policyholder's well-being by ensuring they receive the benefits they are entitled to under the contract, while also upholding the insurer's fiduciary duty. An incorrect approach that focuses solely on the initial physician's recommendation, without seeking further medical documentation or clarification from the provider, fails to meet the regulatory standard for a thorough investigation. This could lead to an arbitrary denial of benefits, violating the principle of fair claims settlement. Another incorrect approach that prematurely denies the claim based on a narrow interpretation of policy language, without considering the claimant's functional needs or exploring alternative care options covered by the policy, also constitutes a regulatory failure. This demonstrates a lack of due diligence and potentially an unfair claims practice. A third incorrect approach that delays the decision-making process unnecessarily, without communicating with the claimant or their representatives about the reasons for the delay and the steps being taken, violates the regulatory requirement for prompt claims handling and can cause significant distress to the claimant. Professionals should employ a decision-making framework that prioritizes understanding the policy's specific long-term care provisions, meticulously gathering all relevant medical and functional evidence, consulting with medical professionals when necessary for clarification, and communicating transparently with the claimant throughout the process. This systematic approach ensures that decisions are well supported, compliant with regulations, and ethically sound, promoting trust and fairness in the claims handling process. Question 8. When evaluating a claim for life insurance proceeds and a beneficiary inquires about the taxability of the payout, what is the most appropriate course of action for an associate, life and health claims professional to take, adhering strictly to U.S. federal tax regulations and ethical claims handling practices? Option A. Provide a detailed explanation of various tax scenarios, including potential estate tax implications and the tax treatment of policy loans, without recommending they seek professional advice. Option B. State definitively that no taxes will be due on the proceeds, as life insurance payouts are always tax-free. Option C. Refuse to discuss any aspect of taxation, citing that tax matters are outside the purview of the claims department. Option D. Inform the beneficiary that life insurance death benefits are generally not subject to federal income tax for the beneficiary, and advise them to consult a qualified tax advisor for personalized guidance regarding their specific tax situation. Correct answer is D. Inform the beneficiary that life insurance death benefits are generally not subject to federal income tax for the beneficiary, and advise them to consult a qualified tax advisor for personalized guidance regarding their specific tax situation. Explanation. This scenario presents a professional challenge because the tax implications of life insurance proceeds can be complex and vary based on the specific circumstances of the beneficiary and the policy itself. As an associate, life and health claims professional, accurately advising or informing beneficiaries about these implications is crucial to avoid financial hardship or legal repercussions for the beneficiary and potential liability for the insurer. The challenge lies in navigating the specific tax laws applicable to life insurance payouts without providing unauthorized tax advice. The correct approach involves clearly communicating that the proceeds are generally income tax-free to the beneficiary, and directing the beneficiary to consult with a qualified tax professional for personalized advice. This is ethically sound and legally compliant because life insurance death benefits paid to a named beneficiary are typically excluded from the beneficiary's gross income for federal income tax purposes under the Internal Revenue Code. By advising consultation with a tax professional, the claims handler avoids practicing law or tax accounting, which are outside the scope of their license and expertise, while still fulfilling a duty to inform the beneficiary of the general tax treatment and the need for specific guidance. An incorrect approach would be to definitively state that no taxes are due without any qualification. This is a regulatory failure because it constitutes providing specific tax advice, which is outside the scope of an insurance claims handler's authority and licensing. It could lead the beneficiary to make financial decisions based on incomplete or inaccurate information, potentially resulting in unexpected tax liabilities. Another incorrect approach is to provide a general overview of tax laws without emphasizing the need for personalized consultation. While not as egregious as definitive advice, it still risks oversimplification and may not address the nuances of the beneficiary's individual tax situation, such as estate taxes or the tax treatment of policy loans or cash surrender values if the policy was not a pure death benefit. A further incorrect approach is to refuse to discuss any tax implications whatsoever. While avoiding unauthorized practice, this can be perceived as unhelpful and may leave the beneficiary feeling unsupported during a difficult time, potentially damaging the insurer's reputation. Professionals should approach such situations by first understanding the general tax treatment of life insurance death benefits as per federal law. They should then recognize the limitations of their role and avoid providing specific tax advice. The decision-making process should involve identifying the beneficiary's need for information, formulating a response that is informative yet cautious, and clearly directing the beneficiary to appropriate qualified professionals for definitive guidance. This ensures compliance, ethical conduct, and provides the beneficiary with the necessary resources to manage their financial obligations accurately. Question 9. Strategic planning requires a claims handler to meticulously assess a claimant's eligibility for long-term care benefits. A claimant's physician has submitted a letter stating the claimant has a significant cognitive decline and is unable to manage their affairs independently. The policy defines long-term care benefits as payable when a claimant is diagnosed with a cognitive impairment and is unable to perform at least 2 activities of daily living, ALHC. The physician's letter does not explicitly list specific ADLs the claimant struggles with, nor does it provide a formal diagnosis code for cognitive impairment. What is the most appropriate course of action for the claims handler? Option A. Request additional documentation from the physician that specifically addresses the claimant's ability to perform at least 2 ADLs and provides a diagnosis of cognitive impairment, while acknowledging the physician's assessment of cognitive decline. Option B. Request a comprehensive medical history from the claimant's primary care physician, including all records from the past 5 years, to thoroughly investigate the cognitive decline. Option C. Approve the claim immediately based on the physician's statement of significant cognitive decline and unable to manage their affairs independently, assuming these imply the policy's criteria are met. Option D. Deny the claim due to the lack of specific ADL limitations and a formal diagnosis code for cognitive impairment, as the provided information is insufficient. The correct answer is A. Request additional documentation from the physician that specifically addresses the claimant's ability to perform at least 2 ADLs and provides a diagnosis of cognitive impairment, while acknowledging the physician's assessment of cognitive decline. Explanation. This scenario presents a professional challenge because the claims handler must balance the insurer's need to verify eligibility with the claimant's need for timely access to benefits, all while adhering to strict regulatory requirements. The ethical dilemma arises from the potential for a delay in benefits to cause significant financial hardship to the claimant, who is likely already experiencing a decline in their ability to perform daily activities. Careful judgment is required to ensure that all eligibility criteria are met without undue delay or unnecessary burden on the claimant. The correct approach involves a thorough and objective review of all submitted documentation against the policy's definition of cognitive impairment and inability to perform at least 2 activities of daily living ALHC. This approach is right because it directly aligns with the fundamental principles of insurance claims handling, which mandate adherence to policy terms and conditions and regulatory compliance. Specifically, the Associate Life and Health Claims (ALHC) framework emphasizes the importance of verifying that the claimant meets the specific criteria outlined in the long-term care policy for benefit eligibility. This ensures that benefits are paid to those who are legitimately entitled, preventing both underpayment and overpayment, and maintaining the financial integrity of the insurance product. It also upholds the insurer's obligation to act in good faith by processing claims fairly and efficiently based on established criteria. An incorrect approach would be to approve the claim solely based on the physician's subjective assessment of the claimant's significant cognitive decline, without verifying the specific policy definitions. This fails to meet the regulatory requirement of objective verification of eligibility criteria. Another incorrect approach would be to deny the claim outright due to a perceived lack of definitive diagnostic codes, without first seeking clarification or additional documentation to confirm the presence of cognitive impairment and the inability to perform ADLs as defined by the policy. This could be seen as acting in bad faith and failing to provide the claimant with a fair opportunity to prove their eligibility. A further incorrect approach would be to request extensive and overly burdensome medical records that go beyond what is reasonably necessary to establish eligibility, potentially causing undue distress and expense to the claimant and their family. This could violate principles of fairness and proportionality in claims investigation. Professionals should employ a decision-making framework that prioritizes a systematic and evidence-based approach. This involves 1. Clearly understanding the policy's specific definitions and requirements for long-term care benefits, particularly regarding cognitive impairment and ADLs. 2. Objectively evaluating all submitted evidence against these defined criteria. 3. Communicating clearly and promptly with the claimant and their representatives regarding any missing information or documentation needed to support the claim. 4. Seeking clarification from medical providers when necessary to ensure a complete understanding of the claimant's condition and its impact on their functional abilities. 5. Making a decision based on the totality of the evidence, ensuring it is consistent with policy provisions and regulatory guidelines. Question 10. Compliance review shows that a claims handler is processing a policyholder's claim for a respiratory condition. The medical report states the condition is located in the superior aspect of the thoracic cavity. Which of the following interpretations demonstrates the most accurate understanding of the anatomical terminology relevant to this claim? Option A. The condition is located in the abdominal cavity, affecting organs like the liver or spleen. Option B. The condition is located in the lower part of the chest cavity, possibly near the diaphragm. Option C. The condition is located in the upper part of the chest cavity, near the lungs and heart. Option D. The condition is located in the front of the chest area, potentially affecting the sternum. The correct answer is C. The condition is located in the upper part of the chest cavity, near the lungs and heart. Explanation. This scenario is professionally challenging because it requires the claims professional to accurately interpret medical documentation, which relies heavily on precise anatomical terminology. Misinterpreting directional terms or body cavities can lead to incorrect assessments of the extent of injury or illness, potentially impacting claim validity, benefit payouts, and the overall customer experience. The need for absolute accuracy in understanding these terms is paramount to ensure fair and compliant claims handling. The correct approach involves a thorough understanding of standard anatomical directional terms and body cavities as they relate to the specific medical condition being claimed. This means recognizing that terms like anterior refer to the front of the body, posterior to the back, superior to above, and inferior to below. Similarly, understanding that the thoracic cavity houses the lungs and heart, and the abdominal cavity contains organs like the stomach and intestines, is crucial for contextualizing medical reports. This approach aligns with the ALHC exam's focus on foundational medical knowledge necessary for claims processing. Ethically, it ensures that decisions are based on accurate information, upholding the principle of fairness to the policyholder. Regulatory frameworks for claims handling, while not explicitly detailed in this prompt, universally require claims to be processed based on factual and accurate information derived from medical evidence. An incorrect approach would be to make assumptions about the location of a condition based on common language rather than precise anatomical terms. For instance, assuming upper back pain is always posterior without considering if the report specifies a more precise location like the scapular region or thoracic spine. This fails to acknowledge the specificity required in medical documentation and can lead to misinterpretations. Another incorrect approach is to confuse different body cavities, such as misinterpreting a condition described as being in the peritoneal cavity as being in the pleural cavity. This demonstrates a lack of fundamental anatomical knowledge, which is a core competency for an associate, life and health claims professional. Such errors can lead to incorrect claim assessments, potentially denying valid claims or overpaying invalid ones, thereby violating principles of fair claims handling and potentially breaching regulatory expectations for due diligence. The professional decision-making process for similar situations should involve a systematic review of all medical documentation. When anatomical terms are encountered, the claims professional should cross-reference them with standard anatomical references if there is any ambiguity. If the documentation is unclear or uses non-standard terminology, the professional should seek clarification from the healthcare provider. This methodical approach, grounded in accurate interpretation of medical evidence, ensures that claims are handled with the necessary precision and integrity, adhering to both ethical obligations and regulatory requirements for competent claims administration. Question 11. Regulatory review indicates that a beneficiary has requested the immediate payout of a life insurance death benefit as a lump sum, expressing a desire for immediate access to funds for personal use. The policy contract, however, outlines several settlement options, including a fixed-period annuity and a life income option, in addition to a lump sum. Claims handler must determine the most appropriate course of action to ensure compliance with regulatory requirements and ethical obligations. Which of the following approaches best aligns with these principles? Option A. Provide the beneficiary with a detailed explanation of all available settlement options as stipulated in the policy contract, including the lump sum, fixed-period payments, and life income, outlining the features and potential implications of each, and allow the beneficiary to make an informed decision, Option B. Advise the beneficiary that the lump sum is the standard and most efficient payout method and encourage them to accept it. Option C. Immediately process the lump sum payment as requested by the beneficiary to ensure prompt satisfaction of their immediate needs. Option D. Offer a brief overview of the settlement options but strongly recommend the lump sum, citing administrative ease for the insurer. The correct answer is A. Provide the beneficiary with a detailed explanation of all available settlement options as stipulated in the policy contract, including the lump sum, fixed period payments, and life income, outlining the features and potential implications of each, and allow the beneficiary to make an informed decision. Explanation. This scenario presents a professional challenge because the claimant, a beneficiary of a life insurance policy, is requesting a payment option that, while seemingly beneficial to them in the short term, may not align with the long-term financial security intended by the policy structure or could expose them to unforeseen risks. The claims handler must balance the claimant's immediate desires with their fiduciary duty to ensure the payout is handled appropriately and in accordance with the policy terms and relevant regulations. This requires a deep understanding of settlement options beyond a simple lump sum and the ability to explain these options clearly and ethically. The correct approach involves thoroughly explaining all available settlement options as outlined in the policy contract and relevant state insurance regulations. This includes detailing the features, benefits, and potential drawbacks of each option, such as fixed period payments, life income, or a combination. The claims handler must ensure the claimant fully comprehends these choices and their implications before making a decision. This aligns with the ethical obligation to act in the best interest of the policyholder and beneficiary, providing them with the information necessary for an informed choice, and adhering to regulatory requirements that mandate clear communication and fair treatment of claimants. An incorrect approach would be to immediately agree to the claimant's request for a lump sum without exploring other options. This fails to uphold the fiduciary duty to ensure the claimant understands all available settlement choices and their long-term financial consequences. It also risks violating regulations that require insurers to offer and explain all contractual settlement provisions. Another incorrect approach is to push the claimant towards a specific settlement option that might be administratively simpler for the insurer, even if it's not the most suitable for the claimant's circumstances. This prioritizes the insurer's convenience over the beneficiary's best interests and could be construed as a violation of fair claims handling practices and potentially predatory behavior. Finally, an incorrect approach involves providing only a superficial overview of the options, without adequate detail or clarification, leading the claimant to make an uninformed decision. This demonstrates a lack of diligence and a failure to meet the regulatory standard for clear and comprehensive communication, potentially exposing the insurer to future disputes and regulatory scrutiny. The professional decision-making process for similar situations should involve a structured approach. 1. Understand the claimant's request and underlying needs. 2. Review the policy contract to identify all available settlement options. 3. Consult relevant state insurance regulations regarding claims handling and settlement options. 4. Prepare a clear, concise, and comprehensive explanation of each option, including its advantages and disadvantages. 5. Engage in a dialogue with the claimant, answering all questions and ensuring understanding. 6. Document the entire process, including the information provided and the claimant's final decision. Question 12. The control framework reveals that a claims adjuster is reviewing a medical report for a life insurance claim and encounters the abbreviation SOB. The adjuster is unsure of its precise meaning in this context. Which of the following represents the most appropriate and professionally sound approach to resolving this ambiguity? Option A. Perform a general internet search for SOB medical abbreviation and use the first definition found. Option B. Consult the company's internal, regularly updated glossary of common medical abbreviations, which is cross-referenced with authoritative medical dictionaries. Option C. Infer the meaning of SOB based on the surrounding text of the medical report and proceed with the claim assessment. Option D. Skip the abbreviation and focus on processing the claim based on the other legible information provided in the report. The correct answer is B. Consult the company's internal, regularly updated glossary of common medical abbreviations, which is cross-referenced with authoritative medical dictionaries. Explanation. The control framework reveals that processing insurance claims efficiently and accurately is paramount. A significant challenge in this process is the accurate interpretation of medical documentation, which frequently employs abbreviations. Misinterpreting these abbreviations can lead to incorrect claim assessments, delayed payments, or even improper denials, directly impacting claimant satisfaction and potentially leading to regulatory scrutiny. The professional challenge lies in ensuring that claims adjusters possess the necessary medical literacy to navigate these documents without introducing errors. The correct approach involves utilizing a comprehensive, up-to-date internal glossary of common medical abbreviations, cross-reference with authoritative medical dictionaries, and relevant industry best practices. This glossary should be regularly updated to reflect evolving medical terminology and coding standards. When an unfamiliar abbreviation is encountered, the adjuster should consult this established resource or, if still unclear, seek clarification from a qualified medical professional or a designated internal subject matter expert. This method ensures consistency, accuracy, and adherence to established protocols for interpreting medical information, thereby minimizing the risk of errors and supporting fair and timely claim adjudication. This aligns with the ethical obligation to process claims with due diligence and competence, ensuring that decisions are based on a clear and accurate understanding of the medical evidence. An incorrect approach is to rely solely on general internet searches for abbreviation definitions. This is problematic because the internet contains a vast amount of information, some of which may be outdated, inaccurate, or specific to a different medical context or specialty than that relevant to the claim. This lack of a controlled, authoritative source can lead to misinterpretations and inconsistent claim handling. Another incorrect approach is to make assumptions about the meaning of an abbreviation based on its perceived context without verification. While context is important, assumptions can be dangerous in a claims environment where precision is critical. This can lead to factual errors in claim assessment and may violate the principle of acting with reasonable care and skill. A further incorrect approach is to ignore unfamiliar abbreviations and proceed with the claim assessment based on the information that is understood. This is a failure to gather all necessary information to make a proper determination. It directly contradicts the duty to thoroughly investigate and adjudicate claims based on complete and accurate medical evidence. The professional decision-making process for similar situations should involve a systematic approach to information gathering and verification. When faced with medical documentation containing abbreviations, a claims professional should first attempt to interpret them using established internal resources. If ambiguity persists, the next step should be to consult authoritative external medical dictionaries or seek expert clarification. The overarching principle is to ensure that all decisions are based on verified, accurate information, upholding the integrity of the claims process and the insurer's commitment to its policyholders. Question 13. Benchmark analysis indicates that a life insurance policy was issued 5 years ago. The insured passed away recently, and the beneficiary has submitted a claim. During the initial review, the claims handler notices a discrepancy between the insured's stated occupation on the application and information obtained from an obituary, which suggests a higher risk occupation. The claims handler must determine the next steps in processing this claim, considering potential misrepresentation. Option A. Deny the claim outright due to the suspected misrepresentation, citing the discrepancy between the application and the obituary. Option B. Forward the claim to the Special Investigations Unit for an immediate fraud alert without conducting any preliminary investigation. Option C. Immediately request additional documentation from the beneficiary and relevant third parties to investigate the occupation discrepancy, while adhering to state-specific unfair claims settlement practices acts and any applicable federal privacy laws. Option D. Pay the claim in full without further investigation, assuming the obituary information is inaccurate or irrelevant to the policy's terms. The correct answer is C. Immediately request additional documentation from the beneficiary and relevant third parties to investigate the occupation discrepancy, while adhering to state-specific unfair claims settlement practices acts and any applicable federal privacy laws. Explanation. This scenario is professionally challenging because it requires a claims professional to navigate the intersection of state insurance laws, federal regulations, and evolving legal precedents when determining the validity of a life insurance claim. The claims professional must balance the insurer's obligation to pay legitimate claims promptly with the need to investigate potential fraud or misrepresentation, all while adhering to strict legal and regulatory frameworks. Failure to do so can result in significant financial penalties, reputational damage, and harm to policyholders. The correct approach involves a thorough investigation that meticulously documents all findings and ensures compliance with the specific state's Unfair Claims Settlement Practices Act and any relevant federal regulations like HIPAA if health information is involved. This approach prioritizes gathering all necessary information, including medical records, policy applications, and beneficiary statements, and then applying the relevant state statutes and legal precedents to the facts of the case. This ensures a fair and legally sound decision, protecting both the policyholder's rights and the insurer's interests. An incorrect approach that relies solely on the initial beneficiary statement without further investigation fails to meet the duty of good faith and fair dealing, potentially violating state unfair claims settlement practices acts by not conducting a reasonable investigation. Another incorrect approach that immediately denies the claim based on a suspicion of misrepresentation without obtaining sufficient evidence or providing the claimant an opportunity to respond violates due process principles and specific state regulations requiring proper notification and evidence gathering. Finally, an approach that prioritizes speed over accuracy, paying the claim without verifying all necessary documentation or investigating discrepancies, could lead to improper payments and potential future liability if fraud is later discovered, and may also violate internal company policies and regulatory expectations for due diligence. Professionals should employ a decision-making framework that begins with a comprehensive understanding of the policy provisions and the claimant's initial submission. This is followed by a systematic investigation guided by the applicable state laws and federal regulations. Key steps include identifying all relevant legal authorities, gathering all necessary evidence, documenting the investigation thoroughly, consulting with legal counsel when complex legal issues arise, and making a decision that is both legally compliant and ethically sound, always prioritizing fair treatment of the claimant. Question 14. System analysis indicates a member is seeking to understand why their recent specialist visit was not fully covered. The member states, "My doctor told me I needed to get a referral from my primary care physician before I could see the specialist, and I always try to use doctors who are in my plan's network to save money." Based on this description, which type of health insurance plan is the member most likely enrolled in, necessitating a PCP referral for specialist care and prioritizing in-network providers? Option A. A plan that covers services only from specific providers within a defined network without requiring referrals. Option B. A plan that allows out-of-network care without a referral but at a higher cost. Option C. A plan that generally does not require a referral for specialist visits and offers out-of-network benefits. Option D. A plan that requires a primary care physician referral for specialist visits and emphasizes in-network providers. The correct answer is D. A plan that requires a primary care physician referral for specialist visits and emphasizes in-network providers. Explanation. This scenario is professionally challenging because a claims professional must accurately identify the type of health insurance plan to ensure proper adjudication of benefits, adherence to network restrictions, and accurate member cost sharing. Misclassifying a plan can lead to incorrect payments, member dissatisfaction, and potential regulatory noncompliance. Careful judgment is required to understand the defining characteristics of each plan type and how they impact claim processing. The correct approach involves recognizing that the member's description of needing a referral from their primary care physician, PCP, to see a specialist, and the emphasis on using in-network providers to minimize out-of-pocket costs are hallmarks of a health maintenance organization, HMO. HMOs typically require PCP referrals for specialist visits and restrict coverage to a network of providers, except in emergencies. This aligns with the regulatory framework governing health insurance claims processing, which mandates adherence to the specific terms and conditions of the member's benefit plan. An incorrect approach would be to assume the plan is a preferred provider organization, PPO. While PPOs offer lower costs for in-network care, they generally do not require PCP referrals for specialist visits and allow out-of-network coverage, albeit at a higher cost. Misclassifying it as a PPO would lead to incorrect adjudication if a referral was indeed required, potentially causing claim denials or incorrect cost sharing for the member. Another incorrect approach would be to identify the plan as an exclusive provider organization, EPO. EPOs also focus on in-network care and do not typically require PCP referrals for specialist visits. If the member's description explicitly mentions the need for a PCP referral, this characteristic differentiates it from an EPO. Finally, classifying the plan as a point of service (POS) plan would also be incorrect. POS plans combine features of both HMOs and PPOs, often requiring PCP referrals for in-network care, but allowing out-of-network care without referrals, usually at a higher cost. The member's description, particularly the emphasis on PCP referrals for specialists, points more directly to an HMO structure. The professional decision-making process for similar situations involves 1. Actively listening to and carefully documenting the member's description of their healthcare utilization and preferences. 2. Cross-referencing the member's description with the defining characteristics of common health insurance plan types, HMO, PPO, POS, EPO, HDHP. 3. Consulting the member's benefit booklet or plan documents if available for definitive confirmation. 4. Applying the specific plan provisions to the claim in question, ensuring all network and referral requirements are met. 5. Escalating to a supervisor or plan specialist if there is any ambiguity. Question 15. Research into a life and health insurance claim reveals that the claimant, who initially qualified for benefits under the own occupation definition of disability, has been receiving payments for 20 months. The policy document states that after 24 months of benefit payments, the definition of disability will transition to any occupation. The claimant's medical condition has stabilized, and they are now capable of performing a wider range of duties than before, though still unable to return to their previous specialized role. The claims assessor is considering whether to continue applying the own occupation definition or to transition to the any occupation definition for ongoing benefit assessment. Option A. Continue assessing the claim using the own occupation definition, as the claimant is still unable to perform their previous specialized role. Option B. Transition the claim assessment to the any occupation definition, as the policy's transition period for this change has not yet been reached. Option C. Transition the claim assessment to the any occupation definition, as the policy's terms stipulate this change after 24 months of benefit payments, and this period is approaching. Option D. Transition the claim assessment to the any occupation definition, as the claimant's medical condition has stabilized, and they are capable of performing a wider range of duties. The correct answer is A. Continue assessing the claim using the own occupation definition, as the claimant is still unable to perform their previous specialized role. Explanation. This scenario presents a professional challenge because the claimant's condition has evolved, potentially impacting the applicable definition of disability under their policy. The insurer must navigate the nuances of both own occupation and any occupation definitions, ensuring the claim is assessed fairly and in accordance with the policy terms and relevant regulations. A critical aspect is the insurer's responsibility to accurately interpret and apply the policy's definition of disability at the time of the claims assessment, considering any policy provisions for changes in definition over time or after a certain benefit period. The correct approach involves a thorough review of the claimant's medical evidence and the specific wording of the disability policy. This approach requires the claims assessor to determine which definition of disability is currently in effect based on the policy's terms and the duration of benefits paid. If the policy transitions from an own occupation to an any occupation definition after a specified period, the assessor must apply the latter definition if that period has elapsed. This aligns with regulatory expectations for fair claims handling and adherence to contractual obligations. The ethical imperative is to ensure the claimant receives benefits to which they are contractually entitled, based on the most current and applicable policy definition. An incorrect approach would be to solely rely on the initial own occupation definition, without considering if the policy's terms mandate a transition to the any occupation definition after a certain benefit period. Failure to update the assessment based on policy provisions and benefit duration is a regulatory failure, as it may lead to the denial of benefits the claimant is entitled to under the policy's current terms. Another incorrect approach is to unilaterally apply the any occupation definition from the outset without verifying if the policy's waiting period for such a transition has been met. This is a breach of contract and an unfair claims practice, as it deprives the claimant of the broader protection offered by the own occupation definition during the initial benefit period. Professionals should employ a systematic decision-making process that begins with a comprehensive understanding of the policy contract, including all definitions and benefit period limitations. This should be followed by a meticulous review of all submitted medical documentation to establish the claimant's functional capacity. The assessor must then cross-reference this information with the policy's definitions and any applicable regulatory guidelines to determine the correct definition of disability to apply at the current stage of the claim. If there is ambiguity, seeking clarification from policy experts or legal counsel is a prudent step. Question 16. To address the challenge of accurately determining and applying the benefit period for a life and health insurance claim, which of the following actions would be the most appropriate for a claims assessor to take when faced with a claimant who continues to experience disability beyond the initial expected recovery timeline, but the policy's benefit period is clearly defined and has a finite duration? Option A. Thoroughly review the policy document to confirm the exact definition and duration of the benefit period, and ensure all benefit payments align strictly with this defined period, regardless of the claimant's ongoing need. Option B. Extend benefit payments beyond the policy's defined benefit period to accommodate the claimant's prolonged recovery, assuming this is a reasonable accommodation for a difficult case. Option C. Terminate benefits immediately once the claimant appears to have reached a plateau in their recovery, even if the policy's benefit period has not yet expired, based on a subjective assessment of their progress. Option D. Continue benefit payments as long as the claimant demonstrates a continued need for assistance, even if this extends beyond the policy's stated benefit period, to ensure the claimant is adequately supported. The correct answer is A. Thoroughly review the policy document to confirm the exact definition and duration of the benefit period, and ensure all benefit payments align strictly with this defined period, regardless of the claimant's ongoing need. Explanation. This scenario is professionally challenging because it requires a claims assessor to balance the insurer's contractual obligations with the claimant's immediate needs, all while adhering strictly to the policy's benefit period provisions. Misinterpreting or misapplying the benefit period can lead to underpayment, overpayment, or denial of benefits, each with significant financial and ethical repercussions for both parties. Careful judgment is required to ensure the claimant receives all entitled benefits for the duration specified in the policy, without extending coverage beyond its contractual limits. The correct approach involves a thorough review of the policy document to precisely ascertain the definition and duration of the benefit period. This includes understanding any specific conditions or limitations that might affect its commencement or termination. The assessor must then apply this understanding to the claimant's specific situation, ensuring that all payments made fall within this defined period. This approach is ethically sound and regulatorily compliant because it upholds the principle of fulfilling contractual promises. It aligns with the expectation that insurance policies are contracts of utmost good faith, where both parties act honestly and fairly. Adhering to the defined benefit period ensures that the insurer meets its obligations as agreed upon, and that the claimant receives the intended financial support for the agreed-upon duration, preventing both undue hardship and unwarranted insurer liability. An incorrect approach that focuses solely on the claimant's continued need for benefits without regard to the policy's defined benefit period is professionally unacceptable. This failure stems from a disregard for the contractual agreement, potentially leading to overpayments that the insurer is not obligated to make, and could result in financial strain for the insurer, impacting its ability to serve other policyholders. Ethically, it breaches the principle of fairness by deviating from the agreed terms. Another incorrect approach that prematurely terminates benefits based on a subjective assessment of the claimant's recovery, rather than the objective end of the benefit period as defined in the policy, is also professionally unsound. This constitutes a potential breach of contract, and an ethical failure to provide the agreed-upon coverage can cause significant financial distress to the claimant who may still be entitled to benefits under the policy's terms. A third incorrect approach that extends benefits beyond the policy's stated benefit period due to administrative oversight or a desire to be lenient, without proper policy amendment or rider, is equally problematic. While seemingly benevolent, it creates an uncontracted liability for the insurer and sets a dangerous precedent. It violates the principle of adhering to the agreed-upon terms and can lead to financial instability for the insurer. The professional decision-making process for similar situations should involve a systematic review of the policy contract, a clear understanding of the benefit period's definition and duration, and an objective application of these terms to the claimant's circumstances. When in doubt, claims assessors should consult with their supervisors or legal counsel to ensure accurate interpretation and application of policy provisions, thereby upholding both regulatory compliance and ethical standards. Question 17. Analysis of a scenario where a claims assessor for a life and health insurer is reviewing a proposed care plan for an insured undergoing treatment for a chronic condition. The treating physician has submitted a detailed plan recommending a combination of specialized therapies, medication adjustments, and regular specialist consultations over the next 6 months. The assessor notes that the proposed therapies are relatively new and more expensive than traditional treatments, but the physician asserts they offer a higher probability of long-term remission. The assessor must decide whether to approve, deny, or request modifications to the care plan. Which of the following approaches best aligns with regulatory requirements and ethical claims handling practices for the Associate Life and Health Claims (ALHC) designation? Option A. Conduct a thorough review of the proposed care plan, verifying the medical necessity and appropriateness of each component against the insured's condition, available clinical evidence, and policy terms, and consult with a medical advisor if necessary to ensure the treatments are evidence-based and cost-effective within the policy's framework. Option B. Deny the care plan due to the higher cost of the proposed therapies compared to standard treatments, advising the insured to pursue less expensive options. Option C. Reject the care plan based on the novelty of the therapies, suggesting the insured wait for more established treatment protocols to become available. Option D. Approve the care plan as submitted, trusting the treating physician's expertise and recommendation for the insured's best outcome. The correct answer is D. Approve the care plan as submitted, trusting the treating physician's expertise and recommendation for the insured's best outcome. Explanation. This scenario is professionally challenging because it requires a claims assessor to balance the immediate needs of the insured with the insurer's obligation to ensure that proposed treatments are medically necessary and cost-effective, all within the bounds of the policy contract and relevant regulations. The assessor must exercise sound judgment, relying on evidence-based medicine and established guidelines, rather than personal opinion or pressure from external parties. The correct approach involves a thorough review of the proposed care plan against the insured's medical condition, available clinical evidence, and the terms of the insurance policy. This includes verifying the diagnosis, assessing the appropriateness and necessity of each proposed treatment, and ensuring that the plan aligns with established medical practice and cost-effectiveness principles. Regulatory frameworks, such as those governing health insurance claims, mandate that decisions be fair, transparent, and based on objective criteria. Ethically, the assessor has a duty to act in good faith, advocating for the insured's legitimate needs while upholding the insurer's responsibilities. This approach ensures that benefits are paid for covered, necessary services, preventing both undertreatment and overtreatment, and maintaining the financial integrity of the insurance pool. Approving the care plan solely based on the treating physician's recommendation without independent verification fails to meet the insurer's duty of due diligence. This approach risks approving treatments that are not medically necessary or are outside the scope of the policy, potentially leading to financial losses for the insurer and setting a precedent for future claims. It also neglects the assessor's responsibility to ensure the appropriateness of care, denying the care plan outright due to a perceived lack of urgency, without a comprehensive review of the medical evidence and the potential consequences of delayed treatment, is also an incorrect approach. This can lead to a breach of the duty of care owed to the insured, potentially causing harm and resulting in a dispute. It demonstrates a failure to adequately assess the medical necessity and potential benefits of the proposed interventions. Rejecting the care plan because it appears more expensive than alternative treatments, without first establishing that the proposed treatments are not medically necessary or appropriate, is ethically and regulatorily unsound. While cost-effectiveness is a consideration, it cannot supersede medical necessity. A proper review must first determine if the proposed care is required for the insured's condition. The professional decision-making process for similar situations should involve a structured approach. 1. Understand the insured's condition and the proposed treatment plan. 2. Gather all relevant medical documentation, including physician's notes, diagnostic reports, and the detailed care plan. 3. Consult internal guidelines, policy terms, and relevant medical literature or expert opinions if necessary. 4. Assess the medical necessity and appropriateness of each component of the care plan. 5. Consider the cost-effectiveness of the proposed treatments in relation to their medical necessity and expected outcomes. 6. Make a decision based on objective evidence, policy terms, and regulatory requirements, documenting the rationale thoroughly. 7. Communicate the decision clearly and transparently to all relevant parties. Question 18. The investigation demonstrates that a claimant, diagnosed with a chronic back condition, has been approved for long-term disability benefits. The claimant's physician and a vocational rehabilitation specialist have jointly recommended a tailored vocational rehabilitation program, including job retraining and placement assistance, to facilitate a return to suitable gainful employment. The claims handler is considering whether to approve funding for these services. Which of the following represents the most appropriate regulatory compliant approach? Option A. Authorize a limited scope of vocational rehabilitation services, focusing only on basic job search assistance to mitigate financial exposure while still offering some support. Option B. Defer a decision on funding for the vocational rehabilitation program until the claimant has exhausted all other avenues for return to work, to ensure all other options are explored first. Option C. Deny funding for the vocational rehabilitation program, citing the primary focus of disability benefits as income replacement rather than rehabilitation services, to control immediate claim costs. Option D. Approve funding for the recommended vocational rehabilitation program, provided it aligns with policy definitions of covered benefits and is deemed likely to lead to a successful return to work, in accordance with state insurance regulations. The correct answer is D. Approve funding for the recommended vocational rehabilitation program, provided it aligns with policy definitions of covered benefits and is deemed likely to lead to a successful return to work, in accordance with state insurance regulations. Explanation. This scenario is professionally challenging because it requires the claims handler to balance the insurer's obligation to manage costs with the claimant's right to receive appropriate benefits and support for recovery. The core tension lies in determining the extent to which vocational rehabilitation services are a covered benefit versus an optional or discretionary expense. Careful judgment is required to ensure compliance with policy provisions and regulatory expectations without unduly delaying or denying necessary support. The correct approach involves a thorough review of the claimant's policy, relevant state insurance regulations, and the specific recommendations from qualified medical and vocational professionals. This approach prioritizes understanding the policy's definition of covered benefits, including any provisions for rehabilitation services that facilitate a return to work. It also necessitates adherence to regulatory guidelines that may mandate or encourage such services when they are medically appropriate and likely to lead to a successful return to gainful employment, thereby potentially reducing the duration of disability benefits. This aligns with the ethical duty to act in good faith and fair dealing, ensuring the claimant receives the benefits to which they are entitled under the contract and applicable law. An incorrect approach that focuses solely on the immediate cost of vocational rehabilitation services, without a comprehensive assessment of their potential long-term benefits and policy coverage, fails to uphold the insurer's obligations. This could lead to a denial of necessary services, potentially prolonging the disability and increasing overall claim costs, while also violating the claimant's rights and potentially breaching regulatory requirements regarding the provision of rehabilitation. Another incorrect approach that prematurely concludes vocational rehabilitation is not covered without consulting policy language or expert recommendations, overlooks the potential for such services to be implicitly or explicitly covered as part of the disability benefit. This demonstrates a lack of due diligence and a failure to explore all avenues for claimant recovery, which can result in regulatory scrutiny and reputational damage. A further incorrect approach that delays a decision on vocational rehabilitation services pending exhaustive and potentially unnecessary internal reviews without engaging with the claimant or their treating providers introduces undue delay. This can frustrate the claimant's recovery process and may contravene regulatory timelines for claim handling and decision-making. The professional decision-making process for similar situations should involve 1. A comprehensive review of the claimant's medical condition and prognosis as documented by treating physicians. 2. A detailed examination of the specific policy provisions related to disability benefits, and any clauses pertaining to rehabilitation services. 3. Consultation with internal medical and vocational rehabilitation specialists to assess the appropriateness and potential efficacy of recommended services. 4. Engagement with the claimant to understand their goals and willingness to participate in rehabilitation. 5. A clear, documented decision based on policy terms, regulatory requirements, and expert advice, communicated transparently to the claimant. Question 19. During the evaluation of a claim for home health services for an insured who was previously discharged from a skilled nursing facility, what is the most appropriate initial step for the claims professional to take to determine coverage? Option A. Review the insured's specific policy contract to identify the definitions and limitations for both facility-based care and home care benefits, and verify that the requested home health services align with the policy's covered services and any applicable state regulations. Option B. Automatically deny the claim for home health services, assuming that the insured's prior need for facility care means they are no longer eligible for home-based benefits. Option C. Approve the claim for home health services based on the provider's recommendation, without independently verifying the specific services against the policy's home care benefit limitations. Option D. Request a detailed medical history from the insured's physician to confirm the need for continued care, without first reviewing the policy's specific coverage for home health services. The correct answer is A. Review the insured's specific policy contract to identify the definitions and limitations for both facility-based care and home care benefits, and verify that the requested home health services align with the policy's covered services and any applicable state regulations. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a claims professional to navigate the nuances between facility-based care and home care coverage, which often have distinct policy limitations and regulatory considerations. Misinterpreting these differences can lead to incorrect claim denials or approvals, impacting both the insured's access to necessary care and the insurer's financial stewardship. The core challenge lies in applying the specific policy language and relevant state insurance regulations to a situation where the line between these care types can sometimes blur, demanding careful judgment and thorough investigation. Correct approach analysis. The correct approach involves a comprehensive review of the insured's specific policy contract, focusing on the definitions and limitations for both facility-based care, e.g., skilled nursing facilities, assisted living, and home care services. This includes verifying if the services being provided are explicitly covered under the policy's home care provisions, such as skilled nursing, physical therapy, or personal care assistance, and confirming that the provider meets any policy requirements for home health agencies or licensed professionals. Crucially, this approach necessitates adherence to state insurance department guidelines and regulations concerning coverage for these services, ensuring that the decision aligns with the insured's contractual rights and applicable laws. This meticulous examination prevents arbitrary denials and ensures that benefits are paid when contractually obligated and medically appropriate. Incorrect approaches analysis. One incorrect approach is to automatically deny home care services simply because the insured has a history of requiring facility-based care. This fails to recognize that policy benefits can differ and that a change in care setting does not automatically negate coverage for a different type of service if it is otherwise covered. This approach risks violating policy terms and potentially state regulations that mandate coverage for specific home care services when medically necessary and contractually allowed. Another incorrect approach is to approve home care services without verifying the specific services being rendered against the policy's home care benefit limitations. For example, proving custodial care under a policy that only covers skilled home health services would be a regulatory and contractual failure. This oversight can lead to overpayment and a breach of the insurer's fiduciary duty. A third incorrect approach is to rely solely on the provider's recommendation without independent verification of medical necessity and policy coverage. While provider input is valuable, the claims professional has a responsibility to ensure that the services align with the policy's terms and conditions and are not simply being provided because the provider suggests them, especially if they fall outside defined covered services. This can lead to claims being paid for services that are not contractually obligated, potentially violating state insurance laws regarding fair claims handling and benefit administration. Professional reasoning. Professionals should approach this situation by first understanding the insured's policy contract thoroughly, paying close attention to the definitions and limitations of facility-based care versus home care. This should be followed by a detailed investigation into the specific services being requested or provided, including obtaining necessary documentation from the insured and the provider. The next step is to cross-reference these services against the policy's coverage provisions and any applicable state insurance regulations. If there is ambiguity, seeking clarification from policy interpretation or legal counsel is advisable. The final decision must be clearly documented, explaining the rationale based on the policy and regulatory framework. Question 20. System analysis indicates a life insurance claim has been filed by an individual claiming to be the deceased policyholder's spouse. The claimant has provided a marriage certificate, but the policyholder's records indicate the beneficiary designation was last updated several years ago and listed a different individual. The claimant states they are the rightful beneficiary and that the policyholder intended to change the beneficiary but passed away before completing the process. Which of the following approaches best ensures proper beneficiary identification and legal entitlement while adhering to regulatory requirements for life and health claims? Option A. Request official documentation to verify the claimant's identity. Obtain a copy of the most recent beneficiary designation form on file and investigate the circumstances surrounding the alleged intent to change beneficiaries, potentially requiring legal documentation or affidavits. Option B. Pay the claim to the individual listed on the most recent beneficiary designation form without further inquiry, as this is the legally recognized beneficiary according to policy records. Option C. Process the claim immediately based on the provided marriage certificate and the claimant's statement, as the claimant appears to be acting in good faith. Option D. Deny the claim outright due to the discrepancy in the beneficiary designation, advising the claimant to pursue legal action to establish their entitlement. Correct answer is C. Process the claim immediately based on the provided marriage certificate and the claimant's statement, as the claimant appears to be acting in good faith. Explanation. This scenario is professionally challenging because it requires balancing the need for prompt claim payment with the absolute necessity of ensuring the correct beneficiary receives the funds. Improper beneficiary identification can lead to significant financial loss for the insurer, legal disputes, and harm to the rightful claimant. The ALHC exam jurisdiction emphasizes adherence to regulatory frameworks that govern claims handling, particularly concerning the verification of identity and legal entitlement to prevent fraud and ensure compliance. The correct approach involves a thorough, multifaceted verification process that goes beyond simply accepting a stated relationship. This includes requesting official documentation such as a death certificate, the insurance policy itself, and legal documents like a will or court order if applicable. It also necessitates confirming the identity of the individual presenting the claim against official identification and cross-referencing this information with the policyholder's records. This rigorous process aligns with regulatory requirements to prevent improper payments and protect the insurer's assets, while also upholding ethical obligations to pay legitimate claims promptly and accurately. An incorrect approach would be to disperse funds based solely on a verbal assertion of relationship or a single, unverified document. This fails to meet the regulatory standard for due diligence in verifying beneficiary identity and entitlement. Such an approach exposes the insurer to the risk of paying the wrong party, which could result in the rightful beneficiary not receiving their due compensation and potentially initiating legal action against the insurer. It also bypasses essential checks designed to prevent fraudulent claims, a critical area of regulatory oversight. Another incorrect approach is to delay payment indefinitely without clear communication or a defined process for the claimant to provide necessary documentation. While caution is warranted, an unreasonable delay without a valid reason or a clear path to resolution can lead to regulatory scrutiny for failing to process claims in a timely manner, as mandated by many insurance regulations. This can also damage the insurer's reputation and lead to dissatisfaction among policyholders and beneficiaries. The professional decision-making process should involve a systematic review of the claim, identifying potential risks related to beneficiary identification and entitlement. This requires understanding the specific policy provisions, the applicable regulatory framework for claims handling, and the insurer's internal procedures. When faced with ambiguity or incomplete information, the professional should clearly communicate the required documentation and verification steps to the claimant, providing a reasonable timeframe for submission. If doubts persist after reasonable efforts, seeking guidance from legal counsel or a supervisor is a prudent step to ensure compliance and mitigate risk.